All right, good morning, everybody. Thank you for joining us for our press briefing here. Today, we're going to cover a couple of different topics with regard to the pandemic. But as always, at first, we want to remind people, folks, we still have a pandemic. And in fact, last week, our hospitalizations rose for the first time in 19 weeks. So we had 18 weeks in a row where our hospitalizations were declining, and then last week they rose. And last week, our positivity rate for the state went above 5% for the first time in 8 weeks. So we are seeing more virus out there in the community. So please continue to use the tools we've given everybody to slow the spread of the virus. That means keep your 6 foot of distance when you're out in public from other people. Wear a mask if you can't do that, or when you go into the store. Wash your hands often. Avoid the 3 C's. Those close contacts, confined spaces, crowded places. Those are all things that will continue or contribute to the spread of the virus. So we want to remind people that the virus is out there. We have seen an increasing in hospitalizations week over week for the first time in 18 weeks. So please continue to take care with regard to slowing the spread of the virus, even as we get more people vaccinated. Now, with regard to the vaccines, we did hear on the White House call last week that the country as a whole will be receiving 5.1 million doses of Johnson & Johnson, which is more than double from the previous week. And here in Nebraska, that means that we'll have about 27,600 doses of Johnson & Johnson. You put that together with the 25,740 Pfizer and the 19,200 Moderna, and you've got 72,500 doses that we will have here in the state this week. The federal pharmacy program is also expanding, and that is going from 17,000 pharmacies nationwide to 40,000 nationwide. We don't have good insight here in the state exactly what that means for us with regard to the number of doses, but you can imagine that if the state allocation is going up to 27,000, that we may see a similar number in pharmacies as well. So you can, obviously, we want people to sign up at vaccinate.ne.gov or call 1-833, it's toll free, 1-833-998-2275 to get signed up. We are in phase 2B throughout the entire state, that is open for health departments. So that means anybody who is 16 and older for Pfizer, 18 and older for Johnson & Johnson, Moderna, can get that vaccine. Now, that doesn't mean your local health department is necessarily in those age categories. They may be at age 40, for example. But it does mean that that option is out there, and that will be the case at all the pharmacies for the federal program, that they'll be doing 18 years old and up. So you can check with the state, sign up at vaccinate.ne.gov. You can look at your local pharmacy, see if they've got slots that are available for scheduling. But please get signed up to get vaccinated, because ultimately that's how we get through this pandemic, is by getting people vaccinated. We're doing well with regard to that. We're ranked in the top 5 as far as seniors getting vaccinated and vulnerable people getting vaccinated. We're doing well from the CDC. I think we're ranked number 14 now with regard to population per 100,000 that's getting vaccinated. I think we actually got down to number 8 last week, so that number is popping around like the number 10, plus or minus 10. But we want to get people vaccinated, because ultimately that's how we get through this pandemic. So please, got my vaccine on Saturday. Process went very smoothly. My arm was sore for a day or so, but other than that, no side effects. So please, get signed up. Your opportunity to get that vaccine may be here before you know it. Our hospital capacity continues to remain very robust. Even with 132 people in the hospital right now, we are still at 43% of our hospital beds are available, 40% of our ICU beds are available, and 80% of our ventilators are available. And then, of course, the other way you can help out is by going to testnebraska.com to make sure that if you've got those symptoms of you lost your sense of taste or smell, if you've got a cough, fever, please don't go out. Go get tested at Test Nebraska to make sure that you don't have the coronavirus. We don't want people spreading that around. All right, so today we're going to have Josie Rodriguez, who is our administrator for health disparities and health equities in the Department of Health and Human Services, talk to us a little bit about our Hispanic community here in the state. We want to make sure that all of our communities are getting vaccinated. Here in Nebraska, what we can see is the Hispanic population, the Hispanic community, it has been getting hospitalized at a rate that is roughly twice of what we would expect. So we want people to get the vaccine because all these vaccines are nearly 100% effective at keeping people out of the hospital and having those severe consequences like death. So it's very important that all of our communities get vaccinated. We're working very hard through different communications campaigns, through the Department of Health and Human Services. Josie tells me we're doing town halls that are being very well attended. I know the Do Right Now campaign is also focusing on this, but we want to make sure that everybody understands their opportunity to get the vaccine and to ask questions about it too. So with that, Josie, I'm going to call you up and say a few words here with regard to the vaccine program.
Hi, I'm Josie Rodriguez. I'm the Administrator of the Office of Health Disparities and Health Equity, and I want to thank Governor Ricketts for inviting me today to talk to you. My responsibility as the Administrator of the Office of Health Disparities and Health Equity is to increase awareness of health disparities that exist. Sometimes people really don't know that they exist, and they've really shown a highlight, especially during this pandemic, on racial and ethnic minorities. We also work with stakeholders across the state to establish relationships, which are key right now during this pandemic, and we work to advance health equity in our state. The pandemic has been difficult, as the governor said, for our Hispanic community, and it's hit really hard for everyone. Many of our frontline workers in hospitals, meatpacking has been affected, and it keeps running through Nebraska. The CDC data shows that Hispanic community is about 3.1 times at greater risk for hospitalizations nationally, and as the governor said, 2 times here in Nebraska. And they face 2.3 times greater risk for death. The impact for me has really hit home too, because my father's from Mexico, so I am Latina. And my mom's grandma's from Mexico as well. And we had a scare recently with COVID because it kind of hit home with somebody getting it, and it was very scary to see that. And so I've seen the impacts it's had on our community, so I think it's very important that we share this message and really urge people to get vaccinated. Many events and celebrations that are important to our community haven't been able to been held because of the pandemic, and a lot of people have felt isolated. So thankful there's a light at the end of the tunnel, which is the vaccines, right? And since the vaccine has become available, DHHS has partnered with several organizations to reach the Hispanic community, and we've provided them with information and the importance of the vaccine. Some of those organizations include Multicultural Coalition in Grand Island. We've worked with the Mexican Consulate in Omaha, and also with Telemundo, which is the Spanish language station here in Nebraska. And we've done quite a few town halls, other town halls, and we've been able to answer questions for our viewers. And that's been very important because a lot of individuals may be hesitant, and this has been able to kind of dispel some of the myths that are out there and answer some of their questions. Unfortunately, we know that there are still concerns and worries about receiving the vaccine, and we understand those concerns. Before you make the final decision, we want everybody to do their own research, attend some of these town halls if you'd like, and just find out more information about the vaccine and get those questions answered. We do have a frequently asked questions page on our website, and you can go to dhhs.ne.gov to get those. Because the virus has impacted us more, it's important that we get vaccinated. We are urging Latinos and Hispanics in Nebraska to register so that they can be notified when the vaccine is available to them. As the governor said, right now we are in the stage where everybody can get vaccinated. 18 it is for 16 for Pfizer, 18 for Moderna and Johnson & Johnson. So if you're eligible, please sign up to get registered. The website is vaccinate.ne.gov. If you're hesitant, please ask questions. Like I said, you can go to the FAQs, and we also have a COVID hotline where you can call and get assistance registering or get a question answered. We also have the registration site in Spanish, so what you can do is go to the vaccine.ne.gov. On the right side, you can click where it says English, and the Spanish site will come up, so that's important for those that speak Spanish. As of today, as you heard the governor already announce, and as I just mentioned, we are at the stage where individuals can get vaccinated if you're 16 years of older for the Pfizer, 18 years of age for Moderna and Johnson & Johnson. And really, we're just urging everyone to get the vaccine so that you can get notified, or to get the vaccine and get registered so you can get notified when it's available. The number to get registered, if you need assistance getting registered, is 833-998-2275. And we do have access for relay calls for deaf and hard of hearing as well on the language line. And we also are able to assist individuals in various other languages. If you don't have an email address or mobile phone and you're not able to ask a friend or someone for assistance, you can call that number that I just stated, the toll-free number that's 833-998-2275, or the other number we have is 531-249-1873. We also have an email address that's available for questions or to get assistance, and that's dhhs.vac-hotline@nebraska.gov. I just want to thank the governor again for having me, and I do really quick want to make a call to action in Spanish for those individuals that speak Spanish and that are watching us. So I'm going to do that real quick. Esta pandemia ha sido muy difícil para nuestra comunidad hispana. Muchos trabajadores de empacadores de carne continuaron trabajando a pesar del riesgo. Como resultados, muchos hispanos sufrieron los efectos del virus. Desafortunadamente, muchos eventos y celebraciones que son importantes para nuestra comunidad se vieron obligados a cerrar y mucha gente se han sentido aislados. El impacto del COVID-19 a la comunidad hispana me impactó a mí personalmente porque soy hispana. Mi padre es de México y mi abuela por parte de mi mamá es de México también, y mi esposo también es de México. Tuvimos un familiar que fue impactado por el COVID-19 y fue espantoso para nosotros que este virus estuviera tan cerca de nuestra comunidad. Así que yo sé qué es el impacto. Debido a que este virus nos ha impactado más a los hispanos, es importante que nos vacunemos. Les pedimos que urgentemente se registren para ponerse la vacuna. Cuando se registren, se ponen en una lista para que les llamen y los notifiquen cuándo es su turno para la vacuna. Como dijo el gobernador ahorita, estamos en la etapa donde todos se pueden vacunar. Es 18 años para el Pfizer, 16 años para el Pfizer, 18 para Moderna y Johnson & Johnson. El sitio web para que se registren es el vaccinate.ne.gov. Puede cambiar el idioma también de inglés a español. Lo único que tiene que hacer es ir al sitio web y en la esquina superior derecha cambiar el idioma de inglés a español. Si tiene dudas acerca de la vacuna o preguntas, puede ir también al sitio web de DHHS y tenemos una lista de preguntas frecuentemente con las respuestas también. Y puede también hablar con su médico. También puede llamar a la línea DHHS de COVID si necesita ayuda para registrarse. Y ese número es el 531-249-1873. O también tenemos el número de 833-998-2275. Bueno, es todo lo quiero nomás decirle a todos que es importante que se vacunan para que se cuiden a ustedes, a su familia y a su comunidad. Recuerden que la vacuna es para que no tengan que ir al hospital o haya algo más grave que sea la muerte. Así que por favor, vacúnense. Gracias. Thank you.
Thank you very much, Josie. All right, next, we're going to invite Shannon Harner to come up. She's the Executive Director of the Nebraska Investment Finance Authority. So with the stimulus package was passed in January, the state of Nebraska received about $200 million through an emergency rental assistance program. That money is being divided up with the state having responsibility for $158 million, and the rest being distributed to Douglas County and Lancaster County, and the city of Omaha and the city of Lincoln. Now, Lancaster County and Lincoln have their site up that you can apply for, and the state launched our site on February 22nd so that people could apply for this rental assistance. Both tenants and landlords can apply for this assistance, and you could get matched up through this program. So again, been out there since February 22nd that you can apply at the state. You can go to coronavirus.nebraska.gov to find that, to be able to apply for the state program or to get links to the Lincoln and Lancaster one. And I believe today, the city of Omaha is launching their program, so that should go live today. And then Douglas County should be coming shortly hereafter as well. So we're going to have Shannon Horner come up and talk a little bit about the program, so that if you are eligible, you can apply for that program. We do expect to take applications through August, but obviously applying sooner rather than later is always going to be better. So with that, Shannon, please come up.
Thank you, Governor. Today, we just want to remind landlords and tenants about the Emergency Rental Assistance Program that's available to help with both rent and utilities for eligible tenants if they're struggling with their payments due to COVID-19 related financial hardship. When the state kicked off its program on February 22nd, the state was the only program that was up and running. As the governor just referenced, as we sit today, the City of Lincoln and the County of Lancaster's programs have been launched, and they are actively assisting residents. And the City of Omaha's emergency rental program is live as of today. The Douglas County program is also planning to launch. We expect sometime in mid-April. We don't have an exact date for that yet, but we will keep you posted. The links to the other programs can be found on the coronavirus.nebraska.gov website or on the websites for those other jurisdictions. All applicants across the state, except those in Lancaster or Douglas counties, should use the coronavirus.nebraska.gov website for their applications. This program does provide assistance for both back rent as well as future rent and utilities. For the state program, back rent is eligible back to April 1st of 2020 and then forward from that. The other programs may have slightly different back rent eligibility dates as far back as March 13th. So you just have to check with your jurisdiction to ensure that you know what the rules are. Most importantly, I'd like to emphasize the program really does help with future rent in 3 months increments for those people who qualify and are in need. There's a 12-month total assistance limit. There's 15 months for specific cases, but for most people, it will be a 12-month limit for their assistance. Utilities that are covered may vary slightly from program to program, so please refer to the proper information for your area. In general, the tenant-paid utilities will qualify. Those would be electricity, gas, water, sewer, garbage, and internet broadband. Those are all potentially eligible expenses. As of right now, the broadband piece, the internet piece, is also eligible on the state program. And so we encourage people to go and check out each program for those utilities. The key to successful application is to have the necessary documents available when you start the application, because you will be required to upload that documentation at the time that you're going through the application. So what will you need? You will need a copy of your lease. You will need proof that your household income is less than 80% of the area median income for your county. Information about every county's area median income can be found at the FAQs on our program website at coronavirus.nebraska.gov. And finally, you have to demonstrate proof of a financial impact of COVID-19 on you or your household. This could be COVID-related medical expenses. It could be proof of unemployment or some other reduction in your household income. In general, proof of income or loss of income can be shown by unemployment payments, W-2 statements, a tax return, or your payroll stubs. It's critically important that landlords and tenants work together on the application, because the information will be needed from both sides to have a successful application. A landlord can start an application, but the tenant is going to also be required to complete their application to verify eligibility for the program. When a tenant is approved, the payment will be made directly to the landlord or to the utility. The third-party representatives who are out there are who may be already working with someone, a caseworker, or even someone at a local public library. If you don't have a computer and you need to go to a library to have someone help you, those third parties are able to help you get through your application. A tenant must be living in the property for which assistance is requested. This is an important point. We've had some questions about it. So a landlord who's already evicted a tenant or a tenant who's already moved on cannot ask for assistance for that back rent. A tenant can always ask for future rent. I would like to note that on April 1st of 2021, the CDC eviction moratorium was extended. It was otherwise going to end on March 31st, and now is extended through June 30th of 2021. NYFA's website and YouTube channels have additional training materials and webinars about the program. There's also a call center available on Monday through Friday from 8 a.m. to 7 p.m., and that number is 833-500-8810. Finally, I'd like to remind tenants to really maximize the available assistance. There are 3 ways for you to maximize the benefits from the American Rescue Act Plan of 2021 for your family, and these include using your stimulus payments for your current needs, not for your old debts. Using rent and utility assistance for exactly that, for your back rent, for your utilities, and for your future rent. And to apply for the child tax credit, which can provide real money in your bank account today. We appreciate your assistance with making both landlords and tenants aware of the Emergency Rental Assistance Program and how to apply. Would also note there is a Spanish site. If you go to the coronavirus.nebraska.gov website, there is a translated Spanish version and FAQs and application information in Spanish as well. Thank you.
Great, thank you very much, Shannon. Appreciate the help with that. Okay. All right, so now we're going to go on to questions and answers. Before we do that, though, just the upcoming schedule. I will have my monthly radio call at 2 o'clock Central Time today as scheduled, and then also our next press briefing will be back here at 10 a.m. next Monday. So that's what our upcoming briefings are going to be. All right, so questions that were emailed in ahead of time. Don Walton from the Lincoln Journal-Star, following your tweet supporting Georgia's changes to voting access, do you want to see any changes in Nebraska's election laws? Well, first of all, I do want to cover the voting laws that were passed in Georgia because there's been a lot of disinformation put out there. When you go take a look at what this law was, it actually expanded voter access by mandating 2 Saturdays of early voting, as well as the option for 2 Sundays. That means 19 days of early, or 17 days of early voting mandated, with the option of going to 19 early days. The 17 early days will be for all counties, so that would be something that would be expanding access there. And by the way, Georgia has a no-excuse mail-in absentee program that states like, for example, Delaware and New York do not have. Also, Delaware, for example, only has 10 days of early voting. New York only has 10 days of early voting. New Jersey only has 9 days of early voting, and they just signed that into law. So you can see when you compare what Georgia's law does, it offers a lot more voter access than what those states do, those other states do on the East Coast. And specifically, when the president talks about, well, you can't give out water, specifically the reason for that being in that bill was that people were electioneering. They're putting stickers on water bottles and handing them out within 150 feet of the polling place. That's illegal. And so that was why that prohibition was put in there. There is no prohibition against the election office themselves handing out water. And in fact, that's allowable in the law. And that's what happened when I went to go early vote. Actually, Douglas County had the office there was handing out bottles of water to people in line. There was no electioneering. It was the election office handing out the water. The president also made a comment about the polls closing at 5 o'clock, and again, he is inaccurate in what he's saying. It's just not true. What the law says, what the law previously had said, was that you would have early voting during business hours. This law codifies that to be between 9 and 5, with the option of going to 7 a.m. to 7 p.m. So for the president to say that they're cutting off voting at 5 is just simply inaccurate. And of course, voting on election day was still going to be at 7 a.m. to 7 p.m. So the president is clearly just not getting briefed on what this law says, and he's making a lot of misstatements that are just factually not accurate. Also, there was people criticizing for the drop boxes. That was not even allowed in voter election law in Georgia prior to the pandemic. It was only allowed under emergency order, which, as we all know, these emergency orders are going to be coming to an end. This codifies in Georgia law that it will become a permanent feature of allowing those drop boxes as well. So again, a lot of misinformation out there with regard to those voting laws. And specifically with regard to Nebraska, we need voter ID. Georgia has had voter ID for a long time. The state of Delaware has voter ID. So that is one of the things we can do to help ensure our election integrity here as well. Julie Anderson, Omaha World Herald. Here's one for starters, okay. Now that the state is open to vaccinating 18 years and older, or 16 for Pfizer, has the governor given any thought to vaccinating students on college campuses? We have weekly phone calls with the local health departments, and I know that several of the health departments are considering doing something along those lines with regard to vaccine clinics for those younger college students. But I don't know, again, it would be for sometime this fall as they're getting ready for that. Just on a related topic, I saw that Rutgers is mandating vaccines to be able to attend there next fall. I would be against any sort of mandate with regard to vaccines for our college students. And cases are up in Nebraska. Has the governor given any thought to tightening up any of the restrictions? We know he's going by hospital capacity. That's exactly right. But is it time to try and clamp down now on some venue capacity, indoor dining, et cetera, to give vaccines time to take hold and before we need to worry about hospital capacity? Again, we set our hospital capacity that we've been following. First of all, that's been our North Star the entire time, is making sure we preserve that hospital capacity. Right now, at 132 hospitalizations, we're roughly, I think it's less than 3% of our overall hospital capacity is being taken up with coronavirus patients. And we have published our chart with regard to where those thresholds are that would trigger more restrictions, and we're going to be sticking with those restrictions. We're not going to move the goalposts on people. We're going to stick with what we published last fall and continue to follow those guidelines. Taylor, did you have anything else?
I do. I have a few questions from Bailey at 10:11.
Bailey at 10:11.
She says, we're hearing from a lot of Nebraskans that they don't want to get the vaccine for various reasons. Rural health departments have said they're worried that not enough of their residents want it. Are you concerned about this? And what would you say to those who don't want the vaccine?
So Bailey's saying we're hearing from some residents that they don't want to get the vaccine, that people in rural areas don't want to get the vaccine. And what would I say to those folks? I'd say, hey, folks, please sign up to get the vaccine. This is how we work our way through the pandemic. When the virus can't spread anymore, the reason the virus won't be able to spread is because you've got antibodies, either because you got coronavirus or because you got the vaccine. And the vaccine is a way to make sure that you can create those antibodies without getting sick, without potentially going to the hospital, and certainly without taking, the chance that you might die because you got the virus. So, please, folks, get signed up. It's safe and effective. Certainly, we're doing very well. We've got 75% of our seniors vaccinated. They're the most at-risk category, but now that we're opening it up, we encourage people to get signed up on vaccinate.ne.gov and wait to be contacted to be able to get the vaccine.
Her next question is, can you give more details on the different communications campaigns HHS is doing? And you might point her to the website that has the ads on it that's next to you.
Right here? Right, so, so Bailey's also asking about specifics with regard to our communications campaigns. finishstrong.ne.gov if you want to go there to get more specifics. But Josie, could you come up and just talk a little about some of the programs we got at DHHS and some of those town halls and that kind of thing?
Yes, as the governor said, we've been doing town halls with many communities across Nebraska. We started in February. We have reached out to the African American community, to the Latino community, and we've worked with some of our refugee communities. I know that the Asian Center, too, has been doing some outreach to their community as well. So we're trying to do a lot. We've had quite a bit of viewers. We've also done some Facebook Live events through DHHS, and then, of course, the Finish Strong campaign, and then we're doing a lot of television ads and also interviews. So we're really trying to reach out to all Nebraskans to make sure that they have the information and the education and are familiar with the website and know where to register. Again, it's vaccine.nebraska.gov to register. So we've had quite a few hits on the Facebook pages when we do town halls, because they're actually live events on Facebook. Just did one, as I mentioned, on Saturday, and we had over 700 individuals. So we're trying our best to reach out to all the communities.
Thank you, Josie. And yeah, we're doing Spanish language radio and Spanish language ads, for example, as part of that outreach. So a variety of different things there to be able to reach people.
Bailey's last question is, do you have any stats on how many people in the rental assistance program has served so far?
Do we have any stats on how many the rental assistance system has served so far? And that is why we have Shannon here to be able to give us the stats on that. Please come on up, Shannon.
Obviously, we don't have stats from the Lancaster County or Lincoln available for you right now. As of, I think what I have in front of me is as of Friday, we had 1.6 million in amounts requested where we've matched the landlord and the tenant. We have funded, whether the checks are in the mail or through the funding process, about 425,000. And we are awaiting match on another about 860,000 rents. On utilities, we have just under 100,000 that has been requested, and we've funded to date about 16,000. The utilities was a little bit more working through how to make sure that the utility providers knew who it was for and we didn't get it sent back. So that took us a little bit longer to get that flow going. We have a lot, as you can tell, a lot more availability for this program. So we really need more people to apply for it. We know the need is there. We just need to get the word out. So whatever you can do to help us get the word out, please do so.
You know how many individuals that is?
It looks to me, no, I do not have stats on the number. Oh, wait, yes. So far, it's 566 that have matched and 238 that are awaiting match. We've had 4,399 users register on the site and start applications. Oh, yeah, and just so that for transparency's sake, we are advertising. We have Facebook advertising. We have advertising in local papers. We have digital ads out. We have those in both Spanish language and in English language. There are social media campaigns. There's a lot of effort being put into getting the word out, but the more people understand, there's, through the community of care as well, there are a lot of nonprofits who are working with their clients to help get those application numbers up and out. So lots of work is being done, but we have much more availability to help people, and that's our goal, is to help people. Any other questions?
Great, thank you very much, Shannon.
Here's a question from Willis at the West Point News. He says, according to the HHS website, less than 43% of the coronavirus vaccine first doses allotted to the federal vaccine program have been used. Is there any way that these doses could be sent to various health departments of the state which are using their full allotment?
So Willis from the West Point is asking about, if you look at our dashboard for the vaccines, it shows the federal pharmacy program and about 43% of those doses being used, and he's asking, can those doses be distributed out to local health departments? Actually, Willis, that is an issue that we've got where we have been doing that. So the pharmacies have been pushing those out to local health departments on occasion. What the issue is with regard to our reporting is that when those doses leave the pharmacy program and go to the local health department, they're not being counted as a pharmacy program getting out. And so we're looking right now how we can improve that reporting to be more accurate, reflecting that. So those doses are being used. It's just not being reflected well in our dashboard that that 43%, those are actually because doses have been moved out because they're not being delivered through the pharmacy program is not getting credit for it. So we've got some work to do with regard to the reporting on that, and we're working on that issue right now.
Grant with AP says it appears the percentage of vaccinated population is lowest in the Panhandle. How much of a concern is that, and why might that be? Are we doing anything to specifically target regions of the state?
So Grant with the AP is asking, it appears that the lowest percentage of vaccination is out in the Panhandle, and are we doing anything specifically there? I know that the health department there is working on communication campaigns as well, and also, just you can imagine that when you got to travel farther to be able to get things done in the Panhandle, you got a population that's more dispersed. It's going to be more difficult to get a vaccine than if you're in an urban area where it may only be a 10-minute or 15-minute drive versus an hour drive. So that may be one of the causes why you're seeing slower uptake with regard to that. But we certainly want people in the Panhandle to get the opportunity to have the vaccine, and so we'll continue to work with the health departments to do that. Great. All right, questions in here? Martha.
Statistics show that Nebraska had the largest increase in number of cases, or the largest growth percentage-wise in cases over the last week. Do you know what's going on, what's driving this? If there's some kind of,
So the question was, Nebraska had a large increase in the number of cases, and is there something with regard to that that we know about? So there's probably a couple of factors at work here, Martha. One is probably the variants, which we know are more transmissible, so that's probably part of it. The other thing that we know is a part of it is that we are picking up more of the codes to capture more of the testing that is being done and more of the positives. So, you know, and what I mean by that is the codes from different healthcare providers that maybe weren't testing a lot of people, but and didn't get entered into the system, so we weren't capturing that data before. So now we're capturing more of those codes and getting more of those data. So we're actually pulling that into our system, and so what you'll see is actually historically, or the historical data will also get updated as we're going back, and as we get more of these providers, you know, getting the codes to be able to capture these providers, then we're going to be going back to April 2020 to be able to capture that data. So you'll see our historical data get updated as well. And Dr. Anton, I don't know if there's anything else that you would want to add to that. You can come up here if you want.
I think that you're right. It's just that some of the codes that probably should have been counted as being for COVID-related lab reports are not, and now they are.
Yeah. So.
And when I just talked to Katie this morning, she said when she looks and separates those out, and we will be able to do that, it's not as large of an increase as what we think.
Okay.
Because of the extra codes.
Okay. So yeah. So there's a combination of things going on here, Martha, with regard to it.
But if it's a case that was from 5 months ago, is that counted in last week's statistics?
Gary, if it was a case from 5 months ago, is that being counted in last week's statistics? If it's getting, we're trying. So yeah, that's part of what we're working on right now as we bring these codes on to see if that's actually being counted currently or if that would just be updated historically. Yeah, go ahead, Martha. Did you have a follow-on question to that?
No.
Okay.
It's a question for Josie Rodriguez.
Okay, Josie, please come up. Martha's got a question for you. And remember to repeat the question, please.
Actually, I have two questions. The first one is, do you have a sense of whether vaccine hesitancy is any greater in some of these communities some of these specific communities that you're targeting than there is among the general population, say, the folks living in the panhandle?
So the question is, do we have a sense of vaccine hesitancy among some of our minority populations compared to others in the panhandle? We at DHHS did do a survey. It was a market-based survey, and it was to many different populations, but we did capture some information for Latino and other minority populations. And I don't know if we have a sense that there's more. I think there's vaccine hesitancy in general for all populations, Martha. And so that's what we're working to improve upon with the town halls that we are doing. You know, as the governor said, we're also doing advertisements on television. We have the Finish Strong in Spanish, and we've done some of our town hall events in other languages, like the one that we did this weekend with the Karen population that was translated in Karen. So it was very interesting to see how many individuals were on there and how many questions we had. So I would say there's vaccine hesitancy in general, and we're just trying to get the word out and provide information and education to as many individuals as we can.
And then my second question is, with the Latino community in particular, but all immigrants, there can be questions for people who may not be legally in this country, or maybe in some, you know, they're not citizens at this point. What's available for them, and how do we get the word out to them?
So the question is, how do we get the word out to individuals that are in Nebraska that may not be citizens here or documented here? Is that the question? Okay. Actually, we're getting the word out to everyone. You know, we don't really know. We're trying to make sure that all populations have information and education that they need to be able to get the vaccine. and to get their question answered. So regardless of what country they come from, we know that it is important for everyone to get the vaccine, and that's why we're providing the information in various languages to many people. On our website, we also have, and I didn't mention this earlier, we have information in various languages. We have the information in the top 5 languages in Nebraska, but we also have some information in other languages as well. So we're just trying to get that word out.
Just like with any vaccine program, citizenship is not asked when you get the vaccine.
That is correct. When we are stressing to individuals on the call that citizenship is not asked, and that we want to make the process as easy for everyone when you go get the vaccine. We're trying to reduce those barriers, be it identification or anything. I know that sometimes we get questions on what do I need to take to my vaccine appointment, and we tell them that may be the confirmation for your appointment, but that should be all that's asked.
I actually have a question as well, Josie. So specifically here in Lincoln Lancaster County, the health department here is doing smaller vaccine clinics for different groups of people. One of those was for the Hispanic Latino community. Has that happened yet? And if it has happened, how did it go? Did you guys see a lot of people signing up for it? Things like that.
So the question was that she's aware that some of the health departments in some of the areas are doing specific vaccine clinics for various populations, and one in Lincoln is one recently that they had mentioned. And is that the one that you're, I know that they did one with the Asian community in Lincoln, and that one was very well attended. I know that Public Health Solutions had another one recently with their community, and I believe that one was well attended too. So we are getting the word out. People are knowing about where to go, how to access the information. I think that it's very important that if individuals cannot complete the information on their own, the form, that you call the phone number or ask a friend to help you fill out the form. So yes, we are seeing increases in the number of individuals that are attending these events and registering for the vaccine and getting the vaccine as well. Any other questions? Thank you.
Thank you, Josie. And Alexa, I will just, I've had the conversation with Pat as well. My understanding is when she's had these smaller clinics, they've been very, very successful. They've been well attended, and they're going over very well. Other questions? Alexa, we haven't had a chance to ask you any other questions, because Martha had her chance. Do you need another chance?
No, I'm good.
Are you good? I'm good. Martha, back to you.
Okay. On a different topic, there recently has, the World Herald reported that a news outlet was not allowed to participate in your news conferences because they were not considered to be credentialed media. Can you explain that and tell us what credentials you're looking for?
So the question was with regard to an advocacy organization that had requested to get access to our press conferences. You have to be a news agency to be able to do that, Martha, not an advocacy organization. News outlets don't put their thumb on the scale when they're talking about different issues. That's what news outlets are supposed to do. Advocacy organizations, on the other hand, advocate. And even the article in your paper, the people admitted they were advocates. So that's the reason. They're advocates. They're an advocacy organization, not a news organization.
Time for one or two more questions.
Yeah, Martha.
Just to follow up though, what credentials are you looking for?
Well, I believe in your own article, you said they're not even allowed to legally take, or they're not even credentialed to take legal notices. So, but again, when somebody applies, we take a look, but if they're an advocacy organization, we're not going to allow advocacy organizations in.
Time for the last question.
All right, seeing none. Again, folks, thank you very much. Again, we remind people that there is still a pandemic. So please continue to use the tools like keeping your distance, wearing a mask, washing your hands, avoiding the 3 C's. All these things will help us slow down the spread of the virus while we get people vaccinated. Again, please sign up at vaccinate.ne.gov or call 1-833-998-2275 toll free. If you need help, if you don't have a computer, if you don't have a smartphone, You can get help that way, but we want people to get vaccinated. We're going to have a lot of doses this week, so we want people to get signed up and get those doses into people's arms, because ultimately this is the way we work our way through the pandemic. Thank you all again very much for being here today, and we'll see you again here, 2 p.m. Central Time will be my radio call-in show. Next 10 a.m. Central Time, next Monday will be the next press briefing. Thanks very much, and thank you, Francis.